Chin implant asymmetry? I had rhinoplasty and chin implant done 5.5 months ago. My chin now looks asymmetric. It protrudes out on the left side. The right side of my lower lip and chin was numb after the procedure. Feeling has returned, but it is very sensitive. My lower lip droops slightly and is difficult to move it on that side. It's still kind of sore around the implant, especially at night. Could this be caused by swelling, scar tissue, or shifting? Would you suggest removal, reposition, or wait until all swelling is gone?
Thank you for your question. You submitted your question with several very good photos, and you state that you had rhinoplasty and chin implant placement 5.5 months ago. You state that it appears that your left side of your chin protrudes more than the right side, and that on the right side you had numbness in the beginning that's gotten better. However, your lip droops a little bit on that side and there's a problem with movement. You state that you also have greater sensitivity in this area, particularly at night. So you're asking about whether or not there is swelling or shifting or some guidance as to what to do. I could certainly share with you my experience performing this surgery, as well as the experiences of my colleagues who also performed this surgery. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Facial implants, particularly chin implants, is a fairly popular procedure and certainly something that we do routinely in our practice. I can certainly understand the challenges that you're facing right now, and I think that as a basic rule of thumb, when an implant is, like a chin implant is placed, it is certainly placed with some basic principles in mind, and I think that most surgeons performing the surgery do the procedure in that way. And this means choosing the right size of the implant. Sometimes we basically use a rule of thumb with most women of below a certain height. We say we'll use a small implant, and we'll sometimes even use sizers when placing the implant, so that we know that the pocket that the implant is going to be in is going to be appropriate. And generally speaking, placement of chin implant is fairly routine. But I can tell you that even something that's routine can become somewhat complicated. And especially in a city like ours, like in New York City, we have so many really very exceptional doctors who perform this kind of surgery, and I have seen plenty of the most prominent doctors even have issues with chin implants requiring revision after revision after revision. I think that from my perspective, that the symptoms you are expressing and experiencing is consistent with movement of the implant. I think that if your implant looked a certain way in the beginning, and that you're noticing that with resolution of swelling that there is a change in the direction of the relative prominence, and concurrently you're getting some issues with sensitivity, that there could be some issues with part of the implant impinging on nerves, on what's called the mental nerve, which is the nerve that supplies the area of the lip and the lower teeth. It's very much possible. There can be swelling, and even although unlikely, fluid like a biofilm from a low-grade type of, or a certain type of infection. Essentially, I think that you can have your doctor examine you, and you can even get imaging studies to look at the implant. But I think the clinical impression is more of a guide. It would be more of a guidance to me as to the indication on whether or not to do something. I think this is a kind of situation where at this point it is not typical to have the symptoms you're having, particularly with the sensitivity and significant symptoms at night. I think I think it's likely that if the implant were removed, those symptoms would get better. I think this is something that you should discuss with your doctor. Again, with the absence of a physical examination, I think the description that you're provided makes me think that there is something that's not quite right, both in the physical appearance as well as in the muscle function, and of course the sensitivity. I think that it makes sense from this arm's length view that removing the implant it would be appropriate. It's up to you and your surgeon to decide whether or not an implant exchange makes sense, depending on what the anatomy appears to be at the time that your surgeon decides to take out the implant, if the two of you make that decision. So I hope that was helpful. I wish you the best of luck. Thank you for your question.